about hair loss, they think about weight loss, they thinking about being fatigued or nauseated. But however, cancer is a big challenge when it comes to you as well as your loved ones. In fact, according to the Center for Disease Control, it says 1 in 4 people that are dealing with cancer are suffering from clinical depression. 1 in 3 cancer, they have mental distress. And that includes 42% of breast cancer patients and 41% of head and neck cancer patients. They experience being sad, worried, afraid, and even angry after being diagnosed. Some treatments for cancer can also affect your feelings and make it hard for you to concentrate or remember things. I have a special guest here today that's going to spread her wisdom with us today. She's has expertise in this area. So I want y'all to help me welcome my guest on today. She is a graduate of Mercer University in 2012 with a master's degree in clinical mental health. Filled with passion to assist clients with increasing awareness and facing life challenges. She has 10 years of working experience with the community based service in inpatient psychiatry hospital, career coaching military spouses, working with children challenged with emotional and behavior disorders, being an Atlanta, Georgia chapter founder of the community nonprofit and a blood cancer survivor, which led her to develop her non for profit Bump Cancer. It is her belief that Bump Cancer can assist various clients in their present moment to gain the breakthrough they see and desire while experiencing their cancer journey. When she is not working, she is enjoying visiting and volunteering cancer patients in different settings and spending time with her husband Chris and her dog Annabella. So, welcome to Warriors Talk, Valencia McGruder.
Thank you. Thank you so very much.
So, Valencia, if I missed anything, just jump right in and just let everybody know that you are qualified to talk about this subject today.
Yes, most definitely. I often forget everything that I have done, and after you read that, it does bring everything into perspective. So, yes, thank you again for having me on your show.
Thank you. I appreciate you and your willingness to share your wisdom with listeners. So, what I want to do first is we mentioned that you are a cancer survivor, and I just wanted you to give a brief summary of what that entails.
Yes, ma'am. So, back on Christmas Eve, 2013, my husband and I went into the ER in the emergency room here in Columbus, Georgia at St. Francis Hospital. Little did we know that after battling a tooth infection, I would actually be hospitalized and informed that I was diagnosed with acute myeloid leukemia, which is blood cancer. Acute myeloid leukemia is exactly what it says. It's not a chronic disease, so it has to be dealt with immediately. What that meant was that I had to immediately stay in the hospital and could not be discharged for a minimum of 4 to 6 weeks. Now, when it came to my diagnosis, I did have to have an emergency surgery to remove my wisdom teeth. At that time, it did cause me to be incubated, and eventually I had to have a tracheotomy on Christmas morning. By Christmas evening, I was actually airlifted from St. Francis Hospital in Columbus, Georgia, and I landed on top of Emory Hospital, where the Winship Hospital went ahead and took me into that ICU unit. So after being placed into that temporary coma for days, I woke up and I was actually moved to a regular room so that we could start the immediate process of chemotherapy. Now, chemotherapy is supposed to come in immediately within 24 to 48 hours for an AML patient. For me, they had to actually stabilize my body. So it took 7 days for them to stabilize me and be able to get my chemotherapy in. Chemotherapy looks a little different for an AML patient because you are connected for the first 72 hours to 2 different chemotherapies and 3 additional bags, an antibacterial, an antiviral, and an antifungal. So there's about 4 or 5 IVs going through your body at the same time. You continue on until the 7th day, continuously receiving chemotherapy. For 7 straight days, you are literally connected to poison going into your body. Now, after you have a couple biopsies, which is basically taking a needle to numb your hip, but then a drill to go into your bone, you have an aspiration that comes out. When it comes to that aspiration, they do have to verify if you are in remission immediately. If not, you're going to have to go through some more treatment, in which it took 6 months for me to complete my treatment. So I was in and out of the hospital for about 75 days total. But I must admit, the wonderful thing about being a mental health therapist is that you are surrounded by other therapists. So they will most definitely keep you encouraged. They're going to make sure that they check in with your feelings and just be friends so that you will be supported, in which I was extremely blessed to have that.
Wow. So you know firsthand when it comes to how mental health actually impact your cancer diagnosis. That was a lot that you went through in that short amount of time.
Yeah, to live in and out of a hospital for 6 months and your view is literally a brick wall, it takes a toll on your mental health. And as I actually went through the process, my friends and I kind of discovered that one of the things that is not immediate in your treatment plan for cancer is mental health. And so over the years, what I did was I reached out to other clinicians like myself and said, hey, you know what? Maybe there should be an organization to provide free mental health because it's not necessarily, quote unquote, needed per se by oncologists. So why don't we just go ahead and provide it to, cancer survivors if they want to talk?
I totally agree. I don't remember my doctor even offering it until I was done with treatment altogether. And I know that you would need it when you're diagnosed to process the information because you don't know what's about to happen, even though, they give you like they gave me a nurse navigator and everything is happening so fast. But you
Mm-hmm.
do need somebody to talk to you to say, you know what, you're going to be okay. Take a deep breath and let's talk about what's about to happen versus you just actually finding out as you're going along, which could be very scary.
Exactly. And so I am a little excited in the fact that when it comes to the world of psychotherapy, we are really focusing on what's called mindfulness. We're actually helping people to understand how to be in the present moment with their actual feelings. Now, you made a great point. When you are actually informed you have cancer, there's several ideas that go through the mind. And when you actually opened the show, I wanted to share a little bit more about my experience. As we were being placed into the inpatient room, the oncologist came in and we had some questions. I was in shock, but the thing was, I was newly married. We had been married barely a year and probably a couple months. So we didn't have children. So I wanted to understand how would this impact my body as of taking chemo in so quickly and I don't have eggs frozen. So I had to deal with the fact that I may lose the ability to have children. When it came to the percentage of expectancy, there's only 27% of AML survivors that surpass 5 years. As I stated, I was diagnosed in 2013, so I've actually made it into the 27%. But once again, if you're informed that very early on in the pamphlet that they handed us, then yeah, mentally you're challenged. So when it came to, being able to understand and process my feelings, I really didn't have any time whatsoever because I went into an emergency surgery. And when it came to that emergency surgery, I was put under, but I didn't come out for 3 days.
That must have been a scary situation for your family to have to go through that. Because
You know, yes, ma'am.
because when we're going through cancer, sometimes people think, oh, it's just a cancer patient, but no, your family is going through that cancer journey right along with you.
Exactly. And so when it comes to mental health, it's not just the care, it's not just about the patient. The caregivers themselves go into an emotional roller coaster. At that time, like Sherry, my husband of 1 year at the time, had to make life decisions for me. He had to say, oh, does she accept blood transfusion? He had to say, okay, if she has a DNR or do not resuscitate, do I honor it? He had to actually make some serious decisions for me in a short amount of time. You got to think that was 4 hours before I was airlifted. So he had to actually tell the doctor which hospital he wanted me to go to. And then not only that, I'm actually originally from Chicago, but I live in Columbus, Georgia. So how does a newly married husband call his mother-in-law and say, hey, your daughter is fighting for her life right now?
Well, that has got to be very overwhelming for a person to go through, not knowing if you're going to make it or not. A lot of decisions have to be made really quickly, and that's why it's important to have a support system around you that's going to be there for you and make sure that you get the best care, even when you can't make those decisions for yourself. So it's important to even have that in place probably before then.
Exactly. And so one of the services that we do with bone cancer is to educate people. A lot of times when I have I call them warriors, but everybody calls them survivors. When we have a survivor that comes in and is sitting with us, what we really want to know is, what are some things that are not only troubling, their roller coaster of emotions, but also maybe having the ability to make really important decisions with a clear mind. And sometimes that's just not necessarily easy to do. And so because I have actually worked at hospitals for such a long time, I do understand what advanced directives are. And I do understand having, someone as a point of contact so that if at any time you're not able to make the decision for yourself, at least you do have someone as a backup.
And that's important. And it's important to have because you don't want people fighting over what they think you want to be done. So even when we're not sick, we should have those things in place. And I know it can seem kind of scary when you think about death and dying and what people are going to be doing while you're not here. But sometimes it just makes it easier on the people who are here and left behind, or the people that are able to make those decisions if you put it in place yourself. So we talking to Valencia right now, McGruder. I know I'm saying it wrong. She's gonna correct me. Go ahead, Valencia. Correct me. Say the last name for me.
It's McGruder.
McGruder. I knew I was going to get it wrong. And she is a professional licensed counselor, and she is a cancer survivor. And she also has a non for profit is titled Bump Cancer, where they offer these services for mental health for people to get these counseling services because sometimes, like she said at the beginning, they're not offered to individuals when they're going through a cancer diagnosis. Sometimes they're offered too late. You already going through something. So these services are out here. They're available for individuals who need these services, who can benefit from the services, because you never know what's going to be the residue behind a cancer diagnosis once you're done going through treatment. So we're talking to someone who's firsthand that's been through a cancer diagnosis and who's working in the mental health field, who can give you the impacts of what an individual will experience going through cancer. So what are some of those impacts, Valencia, that individuals do experience when they're going through cancer?
great question. And it actually kind of trickles back to something that you were sharing. So often a doctor may actually, or an oncologist, should say, will be with you through the process of your treatment. And then towards the end say, oh yeah, maybe you should actually see a therapist. Because often what they associate with cancer is either depression or sometimes PTSD, which is post-traumatic stress disorder. Depression, I think a lot of people do have somewhat of an understanding. Depression often looks like someone that's not only physically sad, but they may actually sleep a lot. They may lose pleasure as in their daily activities. They may not be able to concentrate. You may actually see that this is a person that they used to love to go out and dance or go out and do family activities, but now they're losing their appetite. They don't feel, worthy when it comes to their life. So depression, a lot of times people can identify it. I think also another thing that doctors are able to really detect is like anxiety. And the reason why I say that is I saw a survivor the other day say she had scan anxiety. Often when it comes to a cancer survivor that is going through treatment, you're going to have to be monitored. So you may have an MRI, you may have a CAT scan, or you may have a biopsy like myself, in which you're having to have appointments that are set up at a certain time. So you may have a week out, maybe 2 weeks out. But you know that test will determine if you're in remission or do you have to go back for more treatment. And just sitting there thinking and focusing on that, that's when you're really starting to stress out. You're really starting to, have your emotions take over versus being able to logically think. So that's when that anxiety really, goes ahead and ups your blood pressure because your heart is racing all the time. Or you're probably, more so at the point where you can't sleep because the only thing you can focus on is, oh my goodness, that test is coming up and I've got to make sure that my numbers look good just so I can make sure that I'm in remission and I don't stress out anymore. But I think that there's a couple other things that oncologists may actually miss out. They may actually not talk to a warrior about adjusting. So there is technically what's called adjustment disorder. Now, usually we see adjustment disorder as in, the prime example I give is I'm a northerner and I moved to the south. So for me, it's kind of hard. I don't have my good old, Garrett's popcorn right around the corner from my house. I live on the south side, so it's no longer near my house that I can get that popcorn. Or I don't have the ability to go to, Lakeshore Drive. We don't have a lake that's close to my house, so I don't have that pleasure to actually see that beautiful sight. So I have to adjust from being from the north to the south. And a lot of times we may actually have to adjust with maybe scars. For me, I had a tracheotomy scar. So in the middle of my throat, you'll actually see a little scar. If you take your PICC line out, well, the old-fashioned ones, sometimes with keloids. So I've had keloids on my body. And then other places where I've had IVs. So, other scars that are on my body. Oncologists may not talk about, memory issues. Sounds like you mentioned chemo brain is what I call it. It's the fact that when it comes to your short-term memory, sometimes you're not able to put cohesive sentences together. Instead, it comes out a little jumbled instead of you being able to really express how you feel or what you're thinking. Then good old anger. Anger issues will definitely come, but sometimes I've actually seen substance abuse in some of my warriors. The fact that sometimes oncologists may prescribe maybe pain pills, or they may prescribe antidepressants, where now the person has become dependent instead of being able to use it as needed. But we also deal with a lot of clients that deal with survivor's guilt. And I must admit, this is something that I even had a challenge with. Because as I share, when it's AML, you do not have a lot of survivors. So if you meet another AML person one year, you may not see them the next year. And then you kind of question yourself, well, how is it that I made it, but they didn't? And then the biggest one that I think that a lot of doctors are not closely monitoring is what's called suicidal ideation. Suicidal ideation we think of as maybe being associated with bullying. We may think of it, as being something that would never go hand in hand with cancer. Sometimes it does. It may show up in the form of, why am I still living? That hopelessness, that helplessness of, well, I have to keep taking my treatments forever, so why should I live? And so these are the type of issues that often come up as in mental health issues for cancer patients, but some doctors are just not paying attention to them as closely as they should. And so that's why I really have become a heavy advocate to make sure that people do receive services.
That was a lot that you gave. And just to think that one person may be dealing with multiple of these impacts that can cause from mental health. We're talking about mental health and the impacts of cancer. And Valencia just gave us adjustment disorder, chemo brain, anger issues, substance abuse, survivor's guilt, suicidal ideation. Those are heavy when you think about it. Um, I'm looking at this list, and I know I've been through probably three of them myself. Um, we never know if we're going to need the mental health when we're done. We never know if we're going to need that mental health when we're done with treatment or when we're in the middle of it. I would say just get it anyway. Just get some type of counseling when you're going through, so that when those issues come up, you're way ahead of yourself. You can have a plan in place already. Don't wait until something happens. Get on top of it before that happens. Do you recommend individuals getting into individual counseling or group counseling, just to try to, combat some of these issues that mental health can cause?
Oh my goodness, that is such a great question. I encourage people to start where they're at. And the reason why I say that, sometimes you may have someone that really believes in a group having that support from many people. Or sometimes you may have a person that they are private. They don't want anyone to know or be aware of their feelings. And they truly value that confidentiality one-on-one. And so it really, when we're assessing as in the need of our clients, that's a very important question that we ask. Is it that you prefer to talk to someone one-on-one? Is it that you prefer to maybe reach out into the community and see if there's different organizations that are very close to you? Or the one thing that I am in love with right now is virtual support. There are so many different Facebook groups that a lot of my survivors are in. Even yesterday, I was actually at an event for My Breast Years Ahead, and the organization is truly an organization for all cancer survivors and not just one type. I think sometimes when I say I'm a cancer survivor, everybody will look at my chest and say, okay, wait a minute, she still has her breast. So, okay, it's not breast cancer, is it? And that was the phenomenal thing about this organization. They recognize more than just breast cancer to be associated with an African American woman. Because a lot of times, if you see an African American woman, you're going to kind of associate it with the pink ribbon, but I'm actually the orange ribbon. So it's amazing that there are several different ways that you can get help. And I truly, once again, I truly stress that you have to meet that person where they're at. Don't force them. Just allow them to go with the flow.
I totally agree with that. The one thing you don't want them to do is to withdraw and not do anything at all. So I totally agree with that. If you are just tuning in, this is Warriors Talk with Lady Reshell. We're on Intellectual Radio, and we're talking about mental health, the impact of a cancer diagnosis. And we're talking to Valencia McGruder, and she is a licensed counselor, and she also has her own non-for-profit, which is Bump Cancer, and she's a cancer survivor. So she is qualified to talk about mental health. Valencia, what about grief? Because so many people, when you're going through a cancer diagnosis, you're grieving because you're losing part of yourself when you're going through a cancer diagnosis.
Yes, you most definitely are. I know one of the biggest changes in what's called the Diagnostic and Statistical Manual, or the DSM-5, was that grief disorders were taken out of the book. And they are kind of placed under depression, which I get the professional stance. I totally understand. But when it comes to grieving, I think a lot of people think you're immediately losing the person physically, as in, oh my goodness, this person is going to die. However, there's a lot of grief that happens or loss that happens. A lot of people will lose their hair. When it came to my grieving process of my hair, I was still in the hospital as we took down my two French braids, because that was my favorite hairstyle. At them, I could actually just touch my hair and it would fall out into my hand. And so I gently went ahead and touched it. And as I was letting go of it, in a sense, I was actually letting go of the old me. And a lot of times what we help our warriors to discover is the new person that they have become. Because you are going to have to shed a little of the old person that you are. You used to be a person that was cancer-free and you did not have a diagnosis. Now you're having to take on a new being that you're actually forced into. You didn't ask to get cancer, but you're forced to actually give up the life that you previously knew and now take on a new life. And that goes back to that adjustment disorder. So not only are you losing physical things, for me, I actually lost the ability to walk at one time, to talk, and to actually eat. So with that tracheotomy, I had to learn to swallow again. When it came to me walking, I actually had to get up with my little walker. I was only 37. I thought, oh my goodness, I can't be 37 and have a walker. So I had to relearn how to walk again and to talk. Talking, you really think is something that's so simple. But with the tracheotomy, we had a little speaker in there. And at first I kept thinking, oh my goodness, I've lost my voice. I did regain it, but there's several lung cancer survivors that often lose their voice. Breathe. Some cancer survivors may actually lose a job. I technically did lose my job. I had to be in care for 6 months, in and out of a hospital. My job couldn't cover me after the FMLA had actually ended in 12 weeks. So they had to let me go. So you have a financial struggle that can come along. That's pretty hard when you think about it. And another piece of grief that I think a lot of people may not understand when they're going through their journey is the loss of friends. That is probably one of the hardest things when you're going through a cancer journey. And I know some people are probably, looking at the screen like, oh my goodness, did she just say that? Well, here's the thing, and here's the truth of it. There are certain people that may actually be scared to talk to a cancer survivor that's going through their journey. Maybe they don't know what to say and what not to say. Maybe they feel like if they just step away, then that cancer person can go ahead and go through their journey and get back to being who they used to be. Because a lot of times, our friends and our family, they may distance themselves, not knowing what to do or how to actually respond. And so that's why we not only provide services to the actual person that's going through the journey, but we go ahead and connect those caregivers and those friends that are going through the journey, because they too are losing that old friend that they had that's becoming a new person, a warrior.
A warrior. I like that. And that's a good way to segment into our break. We are going to take a quick break. Again, this is Warriors Talk on Intellectual Radio. We're talking about the mental health impacts of a cancer diagnosis, and we'll be right back. And we are back. This is Lady Reshell with Warriors Talk. We are live on Intellectual Radio. We're talking about mental health and its impact on a cancer diagnosis. The second half of the show has been sponsored by Mary Kay with Gloria Dotson. She is located at, you can actually go to her website, is Mary Kay /GOTSON. And we want to make sure that you are getting this valuable information. We have a licensed professional counselor here on the line. She also is a non-for-profit founder of Bump Cancer, and she is a cancer survivor. We have none other than Valencia McGruder on the phone, and she is giving us her expertise on mental health. Valencia, are you still there?
Yes, ma'am. Still here. Thank you. Thank you.
Well, I just want to let you know that that the listeners are loving your information. They saying that it's very informative, that is true. They said that you are hitting on a lot of things that they have experienced and that they are still experiencing. So I appreciate you for sharing your wisdom on today.
Thank you. I appreciate it.
I wanted to talk about social support. Do you think that social support lessens anxiety and depression?
That's a great question. Often what I have shared with some of my clients is kind of going back to knowing who they are and understanding if they can actually accept being on social media and being transparent. As I mentioned a little earlier, some people are very private. And if they are private, I tell them, you know what? We can most definitely take a social media, break. Sometimes it's good to come away from social media so that you can focus. And when it comes to mental health, you got to be strong mentally in order to work through treatment. When you are on social media, you may have, positive and negative feedback to come to you. And so I do a couple assessments with my clients just to verify if they are emotionally strong enough to go ahead and to post things or to share things with people. Now, sometimes I do tell them, we may need a healthy boundary, meaning when it comes to posting pictures about their journey, maybe posting only certain types of pictures so that they don't present in a negative light. One major boundary that I teach them is please do not have your medical record number posted on social media. Sometimes people may put their actual orders for their chemo treatment. Sometimes they'll put their remission letter onto the website, such as like Facebook or Instagram. And often what they don't see is that their MRIs are there. That's that medical record information. And because I work into a hospital, unfortunately, we have had people that will post their personal information out there and then be affected by some type of breach of their personal information. So you don't want to post your date of birth. You don't want to post your information that, may be just specifically for you, because we don't want anyone to have that identity stolen. So when it comes to social media, those are some of the things where I teach them about boundaries.
Boundaries are important, especially when you're going through. You want to have positive people around you, and you want to make sure that they're depositing positivity into you. If you are just tuning in on social media, please like and share this video. Invite others in on the video. We're talking about mental health and its impact on a cancer diagnosis. We have a licensed counselor here. Excuse me. She's given us some valuable information. She talked about the impacts of mental health, and she talked about the adjustment disorder. She talked about chemo brain. She talked about anger issues that can also lead to substance abuse, survivor's guilt, and suicidal ideation. And those are just some of the impacts that mental health can have on us when we are going through a cancer diagnosis. I didn't want to let you get away without talking about caregivers, because we know that they are also going through something as well.
Yes, most definitely. I think if anything, one of the cutest things that I have seen, I have a friend down in Macon, Georgia, Miss Tara Knight. She actually is the co-founder of Pink Passion, which is a social media organization, and she shares her story about how cancer has affected her and her husband. And I think, if anything, when it comes to a relationship, I think some people think, oh, well, it's going to strengthen them, because of that cancer survivor, the cancer, diagnosis. So they're going to come together and be stronger. And one of the things that hurt my husband and I the most is that as I was walking around in Emory, we overheard some nurses say, oh, her husband didn't go park the car. And we kind of looked and we were like, wait a minute, what do you mean he didn't go park the car? And the nurse explained, oh, well, most spouses, they'll drop off their cancer survivor and just, leave them to us. And I was like, wow. I was in shock because my husband had actually been there from day one. And this is like, the ending of my time to be with that hospital. But he was there every day. And as we kind of looked around, we did notice there were some caregivers that didn't come every day. There were some people that didn't have caregivers like myself that would actually spend the night. I mean, I had to write over 100 thank you cards because these were people that took out time to either come and visit with me, to pray with me, or, and when I say visit, I'm talking about somebody flew in from New York, somebody drove in from Chicago, and someone was sent stuff from California. So we had a lot of different support, not realizing that not everybody has that. And not everybody has a caregiver that's willing to go ahead and do the work. And as you were sharing, that work is sometimes really stressful.
And that's why it's important to get help for yourself, and the caregiver needs to get help as well so that they won't get stressed out, and getting help as far as mentally and getting help physically for other people to maybe step in and give you a break so that you won't get burned out and you won't be resenting the person for being sick and you having to be the one to be there to take care of them. So, caregivers, it's important for you to get help as well. We're talking about mental health as it relates to the impacts on a cancer diagnosis. And we know that many of us that have been through a cancer diagnosis have suffered some of these impacts. And so, what are some things that we can do, Valencia, to maybe, I don't want to say guard ourselves, but kind of like put ourselves in a position to um, not even encounter these? I know you said meet people where they are, but what are some things that we can be doing in advance to maybe not even get ourselves in a situation to where we feel like we need mental health? Not that mental
Uh,
health is not that it's a bad thing to, it'll help keep you sane and get through what you have to get through. But what can we be doing?
yeah, that is a viable question. And I think it's a question that should be answered into your cancer diagnosis. Um, I think it's a matter of people like myself continuing to advocate that um, when it comes to your oncologist, that the oncologist starts off with acknowledging what different services can a hospital provide. A lot of times hospitals have social workers. They have case managers that can find all types of resources for you immediately. So as soon as you're diagnosed, they can provide resources to you. It's also about being able to be a warrior and actually sharing the information. When it comes to social media, social media is instant. So if you have the ability to say, hey guys, this event is going on and it's sponsored by this group of wonderful survivors, just by you actually mentioning that there is a group that supports survivors may actually help someone else. Having the ability to understand and recognize when you don't feel right. The body talks. I mean, our bodies really do talk to us. So if you notice that you are staying in the house often, if you notice that you really don't have an appetite at all, if you notice that, this pattern is starting to develop and it's trendy, where you've been doing it for the last 6 weeks, I think it's that time where you want to go ahead and talk to your primary care physician. Talk to, someone and say, hey, maybe I actually need to go ahead and get some type of help. And there's plenty of different hotlines that are out there that will most definitely help you. I know in the state of Georgia, we have what's called the Behavioral Health Link. I think sometimes people think of a crisis as being a bad thing. A crisis is not necessarily always a traumatic event. A crisis just may be you're at a point in your life and you really just don't know, as in, what to do immediately. So maybe you need to talk it out. Now, I know that nationally, the FCC is actually in, a position now to create what's called a suicide hotline number. So that is in the process. But we do have, a couple different organizations that you can call immediately. So the American Cancer Society, they actually have licensed social workers and licensed professional counselors like myself. So if you go onto their website, and it's just cancer.org, they have either the 800 number that you can call, or they also have their live chat. So once again, this is going right back to having instant results. You can actually chat with someone and see if you're okay. As I was sharing, in the state of Georgia, we have what's called GCal. GCal has an app that you can put on your phone. So you can go to the Apple Store, or you can go to the Google Play Store, put in GCal, which is GCAL. And right then and there, once again, you can talk to a licensed professional as an LPC, a licensed professional counselor, or a licensed social worker. And then you do also have, if you're truly in an immediate crisis, you have the National Suicide Prevention Lifeline. And that number I always just give out because I just think it's necessary for us to understand that someone's out there. It's 1-800-273-8255. It's the best way to go ahead and probably be there for someone. You do have the ability to chat instantly. Their website has a tremendous amount of resources so that you can even put in your zip code and figure out who you can talk to immediately.
Those are some very powerful information. So there's so many resources out here that we can utilize. Talk to people who have already been through it. Talk to another cancer survivor. Share your information. If you've been through something and you utilize a resource, share it with somebody else so that they can also benefit from it. Valencia, you have been giving us some amazing wisdom for mental health. Can you just give us some words of wisdom for someone who may be struggling in their mental health area when it deals with cancer?
Yeah, I think, um, I have a colleague of mine that actually jumped into the bed with me as I was going through treatment. And she reminded me of my favorite phrase when it comes to counseling. When it comes to counseling, we are taught, help the client to feel the feeling and then decide, what are you going to do with it? When it comes to being a warrior, I think it is very important that you have to feel your feelings. The feelings may actually be a roller coaster of ups and downs, but at one point you will have to decide, what do you want to do with it? I also think, if anything, be able to honor your feelings. Most people will try to suppress their feelings. They will try to ignore their feelings. But when you have the ability to honor and stand in your truth, that is the time where you actually begin to heal. And even if it's journaling, maybe it's singing, maybe it's dancing in the rain, be able to go ahead, feel your feeling, and know what you want to do with it.
Wow. Thank you for those words of wisdom. Can you tell us what's coming up next for you?
Oh, well, we have several different events that are coming up. However, we just ended one fundraiser this past Christmas to create more of our self-care packages. Our self-care packages are usually donated to Emory Winship, St. Francis Hospital, but we're actually connecting with even more organizations so that our children will actually start learning about self-care. We're connecting with more mindfulness activities. So you're going to be seeing a little more about yoga onto our website, bumpcancer.org. And then also we're going to be doing a blanket drive here near here in Atlanta, Georgia. We have an organization, or I should say a restaurant, Pie Bites, that is joining us in March so that people will be able to donate blankets Because the one thing that is common in treatment is that you usually get a little chill after you take chemo. So we want to make sure that people are nice and warm.
Awesome. How can everyone stay in contact with you?
They can most definitely email us at info@bumpcancer.org. They can also give us a phone call at area code 706-358-7958. But we've got our social media. We are most definitely on Facebook, where you can just type in Bump Cancer, BUMP, Cancer, CANCER. And then also on Instagram, we like to take a couple pictures. So you can put in Bump Cancer and you'll find us on there.
Awesome. Thank you so much. We were just talking to Valencia McGruder, and she is a licensed professional counselor. She is the founder of Bump Cancer and also a cancer survivor, sharing her wisdom for us today on mental health, the impacts of cancer. Thank you so much, Valencia.
Oh, you're very welcome. And thank you again for having me on your program. This has been phenomenal. I appreciate it.
Thank you so much. And I will leave you guys with these words of wisdom. Courage does not always roar. Sometimes courage is that quiet voice at the end of the day saying, I will try again. Join me next Monday at 6 p.m. right here on IntellectualRadio.com. Stay tuned for Talking with Tone at 7. And as always, warriors, tune in next week with author and founder Lady Reshell, where we are changing lives one warrior at a time. Thank you.
Thank you for listening to this week's edition of Warriors Talk with Lady Reshell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady Reshell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on IntellectualRadio.com for Warriors Talk with Lady Reshell, where we encourage, educate, and empower you into action.